So, guys, today's topic is medical termination of pregnancy and MTP Act. Unsafe abortions are significant contributor to maternal mortality worldwide. World Health Organization estimates that 45% of all abortions globally are unsafe, with 97% occurring in developed countries. In response, India enacted the Medical Termination of Pregnancy Act in 1971 to reduce the maternal mortality deaths by legalizing abortion under specific conditions. Prior to 1971, abortion in India was criminal offence under Indian Penal Code (IPC) Section 312 to 316, punishable by imprisonment. Shantilal Shah Committee in 1964 recommended legalizing abortion to curb the rising number of unsafe procedures. Based on its recommendations, the MTP Act was passed by Parliament in 1971 August and came into force on 1st April 1972. Objectives of MTP Act were to prevent unsafe abortions, to reduce the morbidity and mortality, especially maternal morbidity and mortality, to give legal protection to medical practitioners, to allow women to access safe legal abortion services. So, the key provisions of original MTP Act 1971 were the indication for legal abortion restrict to mother's physical or mental health, fetal abnormalities incompatible with life or severe deformity, pregnancy resulting from rape, failure of contraception, originally limited to married women only. So the gestational age limit is pre 2021 up to 12 weeks requires opinion of one registered medical practitioner. For the pregnancies ranging from 12 to 20 weeks requires opinion of two registered medical practitioners, and for the pregnancies above 20 not permissible except in life-threatening situations. So we need to take consent from adult woman who is above 18 years, and for minors less than 18 or mentally ill, consent from guardian or parents are to be sought. So who can perform MTP? Only registered medical practitioners who have assisted 25 MTPs or who has 6 months of experience in obstetrics or special training in MTP procedures. So the approved place for medical termination of pregnancy or for safe abortions is the government hospital or authorized private clinics, hospitals approved by the state government or central government. So in 2021 Amendment Act for MTP 19 Act 1971 was sought, and for that in this very act, in this very amendment, gestational age which were up to 20 weeks is one RMP's opinion is needed for 20-24 weeks. It is two RMP's opinion. Special categories only are needed, and beyond 24 allowed only if major fetal anomalies are diagnosed and approved by state medical board. So there was the limited eligibility were expanded in 2021 Amendment Act. It included unmarried women for abortion or on contraceptive failure. Special categories eligible for 2024 weeks include rape survivors, minors, incest victims, women with disabilities, human trafficking victims. Confidentiality clause: no person shall reveal name or other particulars of women undergoing MTP. It is punishable with imprisonment up to 1 year, fine, or both. So medical board is needed for every pregnancy above 24 weeks, constituted by state government. It includes one gynecologist, radiologist, one pediatrician, and other specialties. The final decision on MTPs in such cases can be taken by the medical board. So medical abortion, it is by definition non-surgical termination of pregnancy using pharmacological agents rather than surgical methods. This medical termination of pregnancy up to 9 weeks or 63 days from the last menstrual cycle, as per Drug Controller General of India DCGI guidelines. We can give mifepristone 200 milligrams oral, which mifepristone is actually progesterone receptor antagonist. It softens and dilates cervix, detaches trophoblast. And secondly, we can give misoprostol 800 microgram by vaginal, buccal or sublingual route. Prostaglandin, E1 analog as misoprostol, it induces uterine contraction and helps in expelling the contents of uterus. So what protocol we have to follow on the day 1? We can give 200 milligram of mifepristone orally. On day 2 to 3, misoprostol 800 microgram are to be put vaginally or can be given sublingually. And on day 14, follow up to confirm the complete abortion. After this, we have to follow for clinical examination, where the patient should come for the clinical examination, ultrasound scan, and serum beta HCG levels. So there are some contraindications for medical termination of pregnancy. If the pregnancy is ectopic, there is coagulopathy or anticoagulant use, adrenal insufficiency is there, allergy to mifepristone or misoprostol is there, chronic steroid use is there, or severe anemia. Though it is the relative contraindication, it is not absolute contraindication, but it is in the contraindications. The complications of medical abortions are incomplete abortion, excessive bleeding, infection, gastrointestinal side effects, nausea, vomiting, diarrhea, okay, and rarely uterine rupture, especially in the second trimester. So what are the legal consideration in medical abortions? Self-use of abortion pills without prescription is illegal. Sale is regulated under Schedule H drugs. So these two drugs are Schedule H drugs. Registered medical practitioner must maintain the records for first, second, and third. Penalty for unapproved centers or providers is there. So ethical and social issues associated with this is women's autonomy versus fetal rights. Sex selective abortions illegal under PCP and DT Act 1994. Stigma and confidentiality and delayed access due to lack of awareness or fuller facilities. So WHO